I'm Dr. Barbara Howard. I'm Assistant Professor of Pediatrics at Johns Hopkins, and I'm talking today about the next slide, which is Quality Improvement Part 4, Maintenance of Certification. So if you are board certified in pediatrics, you probably got the sorry news that you're going to have to do something to show that you can make quality change in your practice. This is now a requirement for board certified pediatricians every 7 years. It requires a 3-month effort in your office, starting with collection of baseline data, as well as ongoing data as you implement change. And this data has to include documentation of physician decision-making. So you need to attend at least 3 hour-long CME sessions to learn the Plan, Do, Study, Act method. Now, this is not my requirement. This is the requirement of the American Board of Pediatrics and actually also the American Academy of Family Physicians. Next slide shows you what the Plan, Do, Study, Act cycle is. What this means is that you get your team together in your office to pick out what kind of evidence-based practice you might like to implement that would be an improvement in care at your practice. And then you put the changes into effect. That's called Do. And then you look and see how it affected your practice. That's called Study. And then you discuss it with your team and make other changes that would improve the effect. And repeat this cycle as needed. That's called Plan, Do, Study, Act. Now, if that sounds like hard work, the part that's really hard is keeping track of all that data about how you did. And CHADIS is an online system called the Child Health and Development Interactive System that actually collects the data not only from the patients, but from the decision-making you make as you select things in CHADIS. It documents your changes, and we are able to award you Part 4 Maintenance and Certification credit. So CHADIS is currently approved for 2 projects. One is a project for autism screening, and one is a project for developmental screening. You get 25 credits for each of those projects, and as I said, the data collection is taken care of automatically. And in the process of using CHADIS, you can actually make money for your practice as well. Where you can bill 96110, you can make an extra $5,000 to $10,000 per doctor per year better income because the screening is done and the scoring is done automatically for you. We're going to be adding additional modules soon on mental health and ADHD, but everybody needs to do autism and developmental screening right now, so we started with the ones that everybody needs to do. So what exactly is CHADIS? Our doctor right here knows because she's using it. CHADIS is a system that allows parents to do questionnaires online through a secure website that collect before the visit. They collect EPSDT, development, autism, mental health, maternal depression, all those tools that you know you're supposed to do but don't have time. It collects them automatically for you, and you get the results instantly scored and linked to a worksheet with the results, electronic textbook to help inform yourself or your residents and trainees, and a resource database of local and national resources. Are you on the screen that shows a schematic? That schematic shows the parent over there on the right doing her questionnaire from home, the clinicians reviewing the results, and can exchange information with others involved in the care of the child. So for example, CHADIS can email a link directly to teachers to complete the Vanderbilt about ADHD. The results come back scored in a nice graphic display for you, and we're moving towards a very cool feature. Right now, when your patients do developmental screening, what do they get back? Nothing. They get nothing back. They get a better visit, they get screened, but they don't have anything for themselves. We are now producing a memory book, which is an individual web page for each child, where they will get a keepsake that includes their milestones, and they can upload pictures. I'll show you in a moment. So the reason CHADIS is the best solution to this problem is because CHADIS contains all the screens for all ages. You only need one system, and the tool is determined automatically from the first setup that you make. So there's tools for adolescents, screening for depression, substance abuse, all the GAPS things. There are tools for parents, like the Edinburgh Postnatal Depression Scale and partner violence. There are general health supervision tools, including asthma control test and obesity and nutrition questionnaire, as well as the ones you know so well, which is developmental and autism screening. For school-age kids, we also have tools that go into more depth when there's a specific problem, like the SCARED for anxiety or the CHADIS for depression. And we also have quality improvement tools that automatically do your QA surveys from time to time as you wish. So the next slide shows you what the worksheet looks like with this flagged result. In the fail column, you can see the failed MCHAT result. This child also had 4 areas of the ASQ that they failed. The next slide shows you the details where you can see the questions that were asked and the answers that were given. And each questionnaire, you can do that. And then we have a very important special feature. If you've been using the MCHAT for a while, you know that 9 out of 10 kids with a positive MCHAT actually don't have autism. That's a big problem and a big worry to parents. Well, it turns out that there's a tool that was created by the authors of the MCHAT called the MCHAT follow-up interview. The MCHAT follow-up interview on paper can take about 40 minutes and a separate visit. In CHADIS, it takes about 2 minutes and can be done at the same visit. Are you using that already, the follow-up? Well, you could. So when you see the positive MCHAT in CHADIS, you simply go to the link that says take the MCHAT follow-up, and the computer knows which questions you have to follow up on, and it continually rescores it, and then you know whether it's a true positive or a false positive. So it reduces the over-referral rate by 90% so that you know which kids to be worried about and which ones to refer. Here's an example of the question that the MCHAT follow-up. You can probably look on with them since it's catch up with us. The MCHAT follow-up questions, and you just check off the answers in the CHADIS. The follow-up result is then instantly available, and you can look at them on the iPad here. And you can even do an autism observation scale that we've created along with national expert Rebecca Landa from Kennedy Krieger. And the observation scale, you can check off what you see the child doing. There are even little cartoon prompts on the next page that show you what each item means. And as you check it off, it makes a narrative report, which is the next slide, which shows you in full sentences something that you could send as a referral. So it's actually documenting your observations of the child's behavior during the visit. Now, another aspect of CHADIS is that there are places where, if you choose to, you can actually put in your own templates or type into CHADIS and record your own notes in CHADIS. Now, you don't have to do that. You can simply copy CHADIS results and paste them into your EMR. We are working towards a full integration with the major EMRs and an HL7 interface, but it works with every EMR already. One of the features of CHADIS is the ability to show reports, and the next slide shows you the ages and stages with a nice graphic display over time. If you've never seen the ages and stages in a graphic display before, it's because we're the only ones who do that. So it's easy to show to the parent this beautiful color display of how the child is doing and where their results fall in the normal range or the abnormal range. The next slide shows you our memory book, which I was telling you about. This parent has 2 kids, Tommy and Jenny. And when they open the memory book on the next page, they can see the milestone documented by the ages and stages, and they can add their own photographs. In the next slide, you'll see the way they can add stuff or move the milestones. And what they're doing is creating their own baby book keepsake, but it also is an incentive for them to go ahead and do the questionnaires before the visit. In addition to that, care alerts appear automatically. So you see that pink bar across the top? We have been funded by the CDC to make this memory book because people need to be alerted in new ways to change their healthcare practices. For example, about 50% of kids are in the wrong car seat, which means they're not well protected in car crashes. These alerts will appear in their memory book and make it possible for them to be reminded, and until they type in their plan on what they're going to do about it, they will continue to be alerted by the computer that they have a problem there. The next slide shows how parents will be able to search our resource database and look at their own favorite handouts, as well as the ones the clinician can send things to the baby book, but in addition to that, they can actually look for their own things in the baby book and save their favorites to review when they have time to look them over. Now, some other features of CHADIS, besides doing all of these amazing things of doing pre-visit screening, scoring the results, and getting you maintenance of certification credit, you also get an electronic textbook in bulleted outline form, 22 chapters for easy reference, as well as local and national resources, and we'll put in your local resources to make it easy for you to print them for families, and communication links and online consent. So the next slide shows you an example chapter from the eTextbook. The next slide shows you a sample of a resource in CHADIS. This one's about helping your child understand anxiety. Many of the resources are in Spanish as well as in English, and the interface is in Spanish as well as English for the basic questionnaires. The next slide shows you the local and national resource search by zip code so that you can pick out what you want them to send them to and print it for them. And the next slide shows you the online consent form. So when parents log into CHADIS, they have an opportunity to give permission and send invitations to their teachers and do a consent form at the same time that appears for the teacher or the other person they're being referred to, so that that person knows that they've given a legal consent. The next slide shows you how the Vanderbilt appears when it comes back from the teachers. That color graphic display is also unique to CHADIS, and will show the medication dose, and over time it shows you in the red, green, and yellow, corresponding to the scores, what range they're in. This is a wonderful educational tool for parents as well, to show them that the medication you're using is working or not working, and it doesn't of course require that they be on medicine to be able to see how the child is doing as well. Now you may be asking yourself, can my patients do this? I don't even know if they have computers. The answer is, first of all, most people do. Even people on Medicaid, 85% have a computer and internet access at home. But if they don't, or they forget, they can do it in the waiting room. And we did a large study comparing laptops to paper, to touchscreen device, to a telephone administration of CHADIS, which, by the way, is available to you. They listen on the question on the telephone, they push the button on the phone for the answer, the results come directly to your computer result. But what do you think they like the best? They like the iPad, of course. They like touchscreen devices. And now you know the iPad's about $500, but the Amazon Fire is about $100, and you can do it on any smart device, one question at a time. So the kiosk view there is the way it looks to them, and on the iPad it will read to them in English or Spanish. No, well you want one. The Kindle Fire has the color internet interface. It will work with any, not a Kindle book, no. It needs to have a good keyboard in it, and the Kindle Fire has a good keyboard. So a smart device with a keyboard in it. And what you'll get when you do maintenance of certification credit is you'll get a run chart like the next slide, showing how you're doing with your screening over time and what interventions you made. That we send those results, we take care of this, send it to the American Board of Pediatrics, and you get back your certificate after 3 months. You can even have a registry of the kids who are positive in your practice. That's all automated by CHADIS, so the registry is created for you. So CHADIS is really an aid for systems. It not only helps with patient care, but it allows you to coordinate with other providers who are never going to have an EMR. They have internet access, but they're not going to have an EMR, so you can exchange information with them online securely through CHADIS. It's a platform that can deliver a variety of types of questionnaire, and we can put your questionnaire in. So are any of you doing research where you'd like to have certain kind of data collected automatically? Any researchers here? Not today. It's possible to put questionnaires in. Yes? Definitely, Saigon. We'd be happy to do it for Saigon. And then we have to translate it into Vietnamese, we'll do that. But you'll have to help us with the translation. Great. The pricing here, what you'll see, we go on an annual price for unlimited use. This is much cheaper than it would cost you to get all these tools assembled because they're proprietary tools, many of them, and there's a low rate for residents. You can make up to 9 times the cost of your subscription because of the 96110 billing code. Now that doesn't apply to Saigon and Canada, but it does apply in the United States. So the return on investment, if you were to only do 10% of your well visits and the screen was only paid $11, you would break even in 6 months. So I hope you'll be interested in CHADIS. You can go to our website for more information or email me, info@chadis.com, or B. Howard, that's me, @chadis.com. Thank you very much.